We've, through our debate series, come to an understanding that there's a few barriers to mHealth adoption, and we thought, well, rather than try and hope these go away, let's try and tackle them head on.
Question, which was basically, if there was one thing which was going to make a really big difference over the next 5-10 years, what do you think the biggest thing in terms of improving adoption of mHealth is going to be?
To expect people to suddenly adopt a new type of technology that they previously have no experience of either personally, or there's no evidence base to show where that the value will be added for them is a really big ask. So I think starting from now, we have to try and build more of an evidence base, build confidence, raise awareness, and start educating consumers, both from the professional side but also from the patient side.
The thing to tackle really is to understand the motivation of the patient to take on his health, and it's going to be different motivations for different patients, but to find out what the motivation is of a certain patient and really adapt your mHealth service to that is for me the main success factor.
I think essentially the idea of making health invisible. I was having a good chat last night to the lady who runs the Text for Baby service, and she said, we don't have any problems with motivation with our users, because if you're a pregnant mother and expecting, you are totally motivated to use every possible solution available to you. And I think that's just a really interesting concept of how can we just sort of get people to stop thinking about this as being a health negative complaint, a problem-based issue, to actually, I'm living a better life and I'm doing things that are changing, I'm making my sort of wellness more proactive, and I think motivation will come, but I think that'll help if we can somehow put aside some of the jargon and the technology focus.
What do you see right now as the biggest barrier to realising the dream, effectively?
Just convincing doctors that this is actually good for them. This is not going to be a complete overwhelming information overload that gives them much more work to do and gives them much less money. I think it's this integration, is essentially this sort of the meshing of the wheels between these two disconnected systems that are coming together.
For some part, mHealth will make that they get less visits, so it's less pay for them. But on the other hand, there's also certainly a role for mHealth in which it can improve workflow, where it can bring them info anytime and anywhere they want. It can help to remove the administrative burden with e-prescribing and this kind of automatic billing.
We know that we have more lifestyle, more well-being types of applications, but similarly we have more clinical, more medical applications as well. And I'm not sure how successful we're being at lumping all these together sort of under the umbrella of mHealth. I think what we have to convey to both healthcare providers and patients is this is complementary. This is meant to help you. This isn't meant to be seen as threatening or to reduce or to remove sort of more traditional systems of healthcare. It's actually there to build the capacity and to strengthen healthcare systems and ultimately to improve health outcomes.
But we need to recognize the fact, in my opinion, mHealth will never ever take off unless the medical doctor becomes a part of the fraternity. If you look at the 4,100 attendees here, I don't have the exact statistics, I don't think more than 5% are actual doctors, another 10% are retired or doctors who have become economists, who have become administrators and so on and so forth. Unless you excite the doctor that this is a tool which is not a threat to him. I see in the mobile phone a threat. I'll tell you why. Normally a patient comes to me, and when he comes to me, I charge $1, $2 for a consultation fee. Unless you put in place, now here in this mobile health ecosystem, everybody comes up front, gets an ROI, you get contracts, you get, you sell thousands of routers, telecom solutions, health application, hardware, software, applications, etc. The poor little doctor who decides to take a decision whether the 230 blood sugar should be treated or not, at the end of the day, he doesn't get anything. He has to spend his time.
My question is, in the behavior change expertise, what really works? Because for those of us who have been in healthcare for 25 years, we've been trying to change behavior in a variety of ways. So will gaming and online networks that go through mobility actually make a difference?
I think in a sense, one, and I'm not being flip, the doctors are too busy to be here. They're really damn busy people and they're saving lives. I'm consulting to corporations. It's a different sort of valued shift. I'm trying to sort of help, I think, move a space from, this is a way that Bill Thomas, who runs a site called Changing Aging, talks about shifting from physician-centric approach to a patient-centric approach. And I think if you do that, you are necessarily going to expand massively the scope of what we're calling health and what we're calling the medical space. So in a sense, in the past, we used to go have patients coming to the doctor, maybe once a year or more in their office. I think what we're talking about and we're excited about is expanding it to 24/7, 365 patient approach.
I think you prove the point perfectly that doctors need to be involved in the development of this thing that we're calling mHealth at a much earlier stage. It's no good giving it to you as a concluding product at the end that is going to be an issue and is going to be threatening. There are programs, there are projects, there are interventions that you can point to that absolutely do work. I think we need to be building up a much better evidence base about why these things work rather than just showing that they do.
I think this perfectly reflects the two sides of this mHealth revolution, so to speak. On the one hand, the patient side, where you are much more wellness and where the patient can take care of his health in a much better way. But on the other side, you also have really the healthcare system, which can be transformed in a much more gradual way, probably. And it's probably only when the two come together that you really have a powerful mHealth system.